Hello and welcome to the Caring for Kids radio show brought to you by the Children's Hospital of Michigan Foundation. I'm your host, Larry Burns, President and CEO of the Children's Hospital of Michigan Foundation. Tonight is our inaugural show, and we're going to spend some time discussing issues that impact children locally, regionally, and nationally. Each one of our guests tonight is heavily involved in children's health and health care. Joining us tonight is Mark Wietecha, President and CEO of Children's Hospital Association. They represent over 200 children's hospitals and major pediatric programs with a mission to improve child health through innovation in care, education, and research. Matt Friedman stopping by. He's chairman of the Children's Hospital of Michigan Foundation Board of Trustees. We have our governor, Rick Snyder, joining us as well. And Dr. Jeffrey Taub, Division Chief of Oncology at Children's Hospital of Michigan and a professor at Wayne State University, will be our guest as well. And it's all coming up next right here on the Children's Hospital of Michigan Foundation's Caring for Kids on the great voice of the Great Lakes, News Talk 760 WJR. Mark Wietecha is the president and CEO of Children's Hospital Association, representing over 200 major children's hospitals and pediatric programs. Children's Hospital Association's mission is to improve child health through innovation in care, education, and research. Prior to becoming president and CEO, Mark worked for Kurt Salmon for 27 years, serving as the firm's executive chairman. He holds a Master of Science in Pharmacology from The Ohio State University and a Master of Business Administration from Indiana University. And so, Mark, welcome. You are the very first guest of Caring for Kids.
Thank you. Glad to be here.
We're delighted to have somebody with such national exposure and doing such great things as a guest on this inaugural show. And if you don't mind, maybe starting with providing our listeners with an overview of how children in the U.S. are covered health-wise, what types of health insurance do kids have, and then we'll get into some maybe more specifics.
Sure. So in the United States, we've got somewhere between 75 and 80 million kids, depending on the age you like to pick, and they are covered for health care basically in two ways. About half the kids are on commercial insurance through their parents who have commercial insured jobs and have a benefit through their employer. And the other half are covered on publicly funded programs, and those are principally two. There's a Medicaid program, and in Michigan, that's known as Healthy Kids, and that's about 30 million kids, so a big block. And there's a child health insurance program, or what we call the CHIP. In Michigan, that's My Child, and that's another 6 million. So about 50-50 between private employer coverage and Medicaid and CHIP.
Great. And we're talking with Mark Wietecha from the Children's Hospital Association. And why are Medicaid and CHIP so important to children in their health? And I think it's obvious that having health care coverage is important, but explain a little bit to people that may not know of why these two programs are so vital.
Well, these are really critical programs for kids, principally because without Medicaid and without CHIP, you really would have a situation where half the kids in the country would not have formal health insurance or have access to routine things, routine dental care, routine checkups, and then all the usual things kids run into relative to falling off their bikes and having all kinds of mishaps here and there. So these programs were really put in place for all of those families that did not have access to a commercial insurance program. And quite a few working people don't have access to that, as well as those folks who are not working or are at a poverty or an income level that don't let them qualify for any other kinds of programs. So these have become very important programs for kids, and it's roughly half the kids.
Yeah.
So it's how we get things started for them early in life.
Yeah, huge numbers that you mentioned. Now, because we have a new administration in Washington as part of its debate around either replacing or changing, repealing the Affordable Care Act, also known to most people as Obamacare. Congress is taking a hard look at Medicaid spending and how to change it, curtail it. And what do children's hospitals want Congress to keep in mind during this process? After those numbers you just mentioned, it's got to be an important development.
Yes, it's a high priority for everybody, and not just for kids, but for the country. We've got half the kids in the country in these programs, and those are all the future adults that will lead our country forward, run our companies, do all our work, and take care of those of us today, Larry, who will eventually be older.
Yeah, that won't be too far off for me.
The Affordable Care Act, when we went into that back in coming up on 10 years ago, kids were already 95% covered by either commercial insurance, Medicaid, or CHIP, and had a workable benefit. What we are asking Congress to do now as they rethink the Affordable Care Act is not to, in the process, inadvertently reduce or throw away all those kids' benefits that we had before the Affordable Care Act. To some degree, we don't want to really throw the baby out with the bathwater. As you know, most of the Affordable Care Act debate is about adults, whether they should be insured, should not. No one really feels that we should be not covering kids, but at the same time, no one's really talking about it. So we really want Congress to focus in on making Medicaid a great program for children. We want to extend the CHIP, which is also up for reauthorization, technical term to say we want to keep the bill going this year.
Rolling.
And we want to make the program better. So we're really interested in that, and that's our primary mission with Congress.
Well, that's a great mission. And one of the things I learned working at Children's Hospital, it's my second stint in Detroit at Children's, working with them, was that kids don't vote, so they need advocates to represent them, and your organization is the leading advocate, so that's great work. And in closing, if there's one thing a parent who's listening or a grandparent that's listening to this interview that either they should do or know, I mean, is there something you can leave us with that just that might be advice for them?
Yes, they should get involved. It's really important that parents and families reach out to their members of Congress. There's a way to do that. We've got a website called speaknowforkids.org.
We'll put that on our website.
Easy way to reach out. And there's one reason really for doing it. You never know, if you're young parents, whether your next child might be born prematurely and have some health problems. You just don't know that. You don't know when your kid might fall off their bike or have some accident. You don't know that.
Just don't know.
And if you're grandparents, you never know when your grandkids may have some health problems that really require a program like Medicaid, even if you have commercial insurance. Medicaid provides additional services and additional programs if you're hurt pretty badly that commercial insurance doesn't have. So these are important programs for all children. And unless we are active in making sure Congress knows we think it's important, that message will be lost. So people should get involved.
All right. We're going to spread that message on this show and then beyond. And I want to thank you, Mark, for being on the inaugural show of Caring for Kids. And I know you were born in Detroit, so come back and see us, please. And I know you helped out Dr. Herman Gray when he was president of the hospital. And so you have a warm welcome mat here in Detroit.
Always glad to come back. There's 1 million kids in Michigan on Medicaid, and you've got some great children's hospitals. So thank you.
You're welcome.
For everything you've all done, and good luck with everything.
Thank you. Thank you. That was Mark Wietecha from the Children's Hospital Association. And coming up next, we're going to hear from Matt Friedman from the Children's Hospital of Michigan Foundation Board of Trustees. And that's when Caring for Kids, the radio show, continues here on the great voice of the Great Lakes, News Talk 760 WJR. Welcome back to Caring for Kids. In the studio now is Matt Friedman. Matt has been the chairman of the Children's Hospital of Michigan Foundation Board of Trustees since 2014. Matt is co-founder of Tanner Friedman, a successful communications firm located in Farmington Hills, Michigan. He also chairs the Detroit Regional Chamber's PR and Marketing Advisory Council. Among other things, Matt is a leader in the Detroit community and has been recognized by the Detroit Regional Chamber as Volunteer of the Year, Crane's Detroit Business, 40 Under 40, and D Magazine's 30 in Their 30s for his professional accomplishments and community service. And it's a pleasure to have Matt Friedman in the studio. Matt.
Larry,
hello.
Thank you. I should note that those awards about my age were a few years ago.
Right. No.
I'm no longer eligible for those awards.
Well, you're eligible for many more, and I'm sure those will occur. And this is part of the inaugural show of Caring for Kids, and so to have you as chairman of the board of the foundation is a delight. And so what I thought I'd ask you is how did you get involved? You were on the hospital board prior to being on the foundation board. And sort of what drove you to get involved with the hospital and then the foundation?
I was at a point in my career about a dozen years ago where I felt like it was time for me to start focusing on something in the community that I could help and add value to. And I would encourage everybody in business to think about when that moment should be for you. How much better would our community be? How much better would our state be if everybody in business thought to themselves, what can I do as a volunteer to make this a better place? And what I decided to do was focus on children's health, particularly in the city of Detroit, to follow a family tradition. My grandfather was a physician here in the city and actually started a hospital in the 1950s just a few blocks from where we're sitting now in what's now the News Center area.
Okay, wow.
Because his black patients and his Jewish patients couldn't get the care he thought they deserved at the big hospitals because of quotas and other factors. He started a Park Community Hospital right here in Detroit. My father was on the board of Children's Hospital to try to carry on that tradition, and when an opportunity came for me, I decided to take advantage of that and be the third generation of my family. So this is a mission very important to me. As it turned out, one of my children, my daughter, needed some health care, and we relied on a doctor affiliated with Children's Hospital of Michigan who has become a valued member of our family, practically because of the outstanding care he's provided to us. And it cuts very deep, and I think it's very important. And I think as a community, there's nothing more important than we can do to make sure our kids are healthy.
Yeah, and one of the things that I was just talking to our previous guest from the Children's Hospital Association is, kids can't vote, and so they need advocates, business people, and people like you to make sure things continue. So that's very commendable. And we're talking with Matt Friedman, chairman of the board of trustees of the Children's Hospital of Michigan Foundation, and also co-founder of Tanner Friedman Communications in Farmington Hills. And so our listeners are going to learn more and more each month and hopefully each week about our foundation. And so can you start that conversation a little bit about some of the things that you feel that the Children's Hospital of Michigan Foundation is doing that people need to know about and why it's important?
Well, I appreciate that WJR's audience is going to have a chance to learn about our foundation, because I think the work that we're doing and the work that we have the potential to do is impacting and going to impact so many lives, not only with children here in Metro Detroit and across Michigan, but I think all over the world. If you look at some of the research and some of the programs that we're funding, you'd be proud to know that they existed anywhere practically on planet Earth. Right. The fact that they're going on here in Detroit and around Michigan should be a point of pride for all of us. But I want the WJR audience to understand that when you donate to the Children's Hospital of Michigan Foundation, you're donating to projects that are going to have a real impact on kids' health. We're working on funding diseases that don't have cures. We're working on funding programs for kids that would not exist otherwise if not for the funding. And it's something that I am really looking forward to more and more of our community learning about, knowing about, and getting involved in.
Excellent. And sort of a follow-up question. Again, we're talking with Matt Friedman, chairman of the board of the Children's Hospital of Michigan Foundation. And how do you see the foundation playing that role in health and health care? You know, we don't provide services at the foundation, medical services. And so how do you see us playing a role in that?
One of the things I've learned in my career in communications and working with healthcare companies is it takes a lot of money and a lot of time to make a difference to move anything in healthcare forward. And you really can't make advances in health without those two factors, money and time. Mm-hmm. Well, we can't control time, but what we can do over time is raise the funds that are needed to really make a difference, make advancements possible, and make programs sustainable and effective. That's what we're able to do in a way that nobody else is doing right now.
Excellent. And so, I'm pretty new to the foundation, and I'm honored to be serving as the president of the foundation. It was an opportunity to work for a brand and an organization that I'm very familiar with, come home and continue my career. And so I want to thank you and the board for that opportunity.
It's great to have you here. Great to have you back. That's important.
And I'm back here at WJR with Mark Blackwell. And so a really important question is, how do you see the next 5, maybe 7, 10 years evolving for the Children's Hospital of Michigan Foundation? What's the vision?
Well, this is an opportunity for everybody who listens to this show and this station to get involved in any way that makes sense for them, because we need to do more with more.
Right, I like that.
And in order for kids to be as healthy in this community as they need to be, so they live productive lives as our neighbors, maybe someday our bosses, the people we'll sell our homes to when it's when we're ready to move on and do other things. In order for that population to be healthy and to be what we need it to be here in Michigan, we need to support them. So I encourage business people listening to get involved. We have a great board of a couple of dozen true leaders in our community. We have room for more involvement. Right. And when it comes to fundraising, of course, we're looking for gifts that can really make a difference and really make programs possible. But this foundation and support really for Children's Hospital historically has been built through community involvement and community gifts. The kinds of checks that show up every year because you know that your neighbor was helped by a doctor at Children's Hospital, or you know that a cousin has a kid with a disease that has no cure and you want to do what you can here in our community. Those kinds of checks, those kinds of contributions really matter. So I think over the next 5 or 10 years, there's a chance for so many more people in Michigan to get involved in what we're doing and feel a part of it and see the benefits in our kids. Excellent.
And a little follow-up on that is with the energy that Detroit has, downtown, midtown, New Center area. Do you think that the sort of resurgence of Detroit will play a factor in our foundation and the hospital?
I think so. I think if you look at other cities around the country that have experienced what Detroit wants to experience, a lot of it is about what we call eds and meds. It's about education and medicine. Right. And what could be more important when it comes to education and medicine than kids and education about kids' health and medicine related to kids? So I see our foundation playing a big role. And a lot of people have said to me, since they've known I've been involved and I've been chair for the last couple of years, what's something I can do to help in Detroit? I know you're active in Detroit and the comeback. And I tell them all the time, what could be more important than the health of children in our community? That's what we can build around.
Right. And you're doing it so well. And so let me ask you this. How are things at the Friedman Tanner office?
Thank you. Well, it's either Friedman Tanner or
Tanner Friedman. Yes.
Well,
I'm looking at you.
Either way, it's fine. We are off to a great start in 2017. We have a lot going on with some really good clients who are really serious about doing communication the right way and making communication and PR a priority. And that's what we're able to do. But we really have 3 customers: our clients, the journalists we work with on the media relations side of our business, in the community. And I'm proud to serve the community as part of the Children's Hospital of Michigan Foundation.
Absolutely. And so I changed the name of your firm, but I put you first.
Yeah. You know what? You didn't see me arguing, did you?
All right. Good. Well, thank you for all you do. Thank you for being on the show. Thank you for your service to the foundation and all the other things you do for the community. And it's an honor to work for you and the other board members. So thank you, Matt Friedman.
Larry, thanks for the opportunity to be here, and thanks for getting this show together to let more people know about the great work the foundation's doing.
Excellent. And we're going to learn more. We're going to hear from our governor of the great state of Michigan, Governor Rick Snyder, when we return to Caring for Kids, right here on the great voice of the Great Lakes, News Talk 760 WJR. Governor Rick Snyder is the 48th governor of Michigan. Raised in Battle Creek, Governor Snyder is an alum of the University of Michigan. His background in being a successful job creator at PwC, formerly Coopers and Lybrand, Gateway, and an Ann Arbor-based venture capital fund has helped him better serve Michigan. He has successfully implemented Healthy Michigan, a plan that has provided affordable and quality health care for more than 600,000 Michiganders. So, Governor, welcome to Caring for Kids.
Oh, it's great to be with you.
Appreciate it. I know you're a very busy man, but I also know that children and health care are extremely important to you, and I appreciate and our listeners appreciate you taking time. And I thought we'd start with, what can you tell our listeners about health care coverage for our children in the state of Michigan?
Well, it's critically important because our kids are our future, and we want to make sure we provide great opportunities. And it's one of the things you start with is their health. If they're healthy, they have better opportunities to learn, to be successful, to hopefully grow up and raise their family in Michigan. And one of the areas I'm really proud of in terms of expansion has really been in the Healthy Kids Dental area, to give you one illustration.
Yes.
It's an area that we started several years ago in terms of increasing our investment in, and we've increased it to over 1 million Michigan kids now. Will get quality access to dental care, and that's up over 600,000 more than 2010.
And many of these kids, I believe, they wouldn't have dental care without this program.
That's correct. When I came into office, it covered a certain number of counties, a number of the smaller population counties, and now we've got the entire state covered. Wow. And so that's an important area in terms of really health care, because dental health has a much bigger impact on overall physical and mental health than people might imagine.
Absolutely, and I think it also probably involves self-esteem and all sorts of things as kids turn into adults, so that's great. Now, with the new administration in Washington and talk about the possible repealing the Affordable Care Act, what can Michigan do to help protect our kids and families who could be affected by any of those changes?
Well, one of the things is I think we're being very active in terms of the dialogue about what happens with the Affordable Care Act. And so we were an expansion state where we added Healthy Michigan, which is Medicaid expansion for really adult-age people. And it really affects a situation where we added personal responsibility and wellness on the front end. We were able to get some flexibility from the federal government, and it's been a major success. We've got over 640,000 new participants in the program, and it's working well. We're seeing many more visits to primary care physicians, preventative care. Actually, when we've talked to enrollees in the program, the amount of emergency room visits they say they were making and urgent care visits has dropped dramatically.
Yeah,
and if you think about it, doesn't that make sense to all of us to say we all save when that happens?
Absolutely. And so now Congress is taking a hard look at Medicaid, as you well know, and we're talking with our Governor, Rick Snyder, from the great state of Michigan. And with all the changes in Washington and the leadership, what can hospitals and medical professionals and anybody, I guess, listening to this show, what can they do to influence discussions and eventually decisions?
Well, talk to their congressmen. I encourage them to talk to our congressional delegation, both senators and representatives, and to the White House. But hopefully we're helping lead the charge. That's one of the things as a governor, I've been very proactive on this. And I can tell you, I've talked to senators and congressmen this week alone about this topic in several cases. So we're being very loud about this, about how we can continue things like Healthy Michigan to help people do well, Larry, because it's important. Because too often people just talk about the financial aspects of this. And this is about real people's lives. And we actually have gotten great testimonials through the Michigan Hospital Association and other healthcare providers where people have come forward to say this is, potentially saved their life or allowed them to work where they weren't able to work before. And that's a win for them on a human level, and it's a win for all of us.
Yeah, and that really is saving lives as much sometimes as, helping somebody with a disease. And so, I want you to know and your staff that the Children's Hospital of Michigan Foundation wants to be known as a statewide child advocacy group. And if there's anything we can do to help, we're just simply a call away. So we're just kind of getting started on that and this new statewide initiative, but I would love to work with your office.
Well, it's great how you're doing the show. Again, this helps get awareness up and hopefully gets people's involvement up and opportunities to learn about even more successes, or if we have problems and issues, and we do in some areas, how we can find those and address them.
And work together, yes. And you started a program that is putting social workers in schools to help families, which I think is much needed and a great program. And can you tell our listeners a little bit about that program and why you think it's important?
Oh, sure. It's called Pathways to Potential. And it's a great program, and the concept was simple. It's like too often we've got some really talented caseworkers, people on the human services side, but they tended to be located in government offices. And the way I viewed it is did it make sense that someone may have to take one or two buses, or it's a challenge to get to these offices to see people and get some assistance, versus saying, shouldn't we go to where our customers are, where the citizens are? And so we went out and talked to our caseworkers, and they were all excited to do this in a pilot fashion, and the idea was, let's place them in the local school so they can be right there with all the kids, and they have an opportunity to see their parents and the families and how they can help them more directly right in their community so they can understand their entire environment better. And so we started with a pilot. It's expanded a lot. We're now in over 250 schools in 33 different counties. And this is something I asked for additional budget resources to continue to expand the program, and it's been working. We've seen one of the metrics we use to measure success is how much has chronic absenteeism gone down by kids, and it's gone down dramatically where we've had these pathways people helping in the schools.
That's a great program. The foundation supports a program because of the Jewish Fund is supporting the foundation in Hamtramck. We're providing immunization for the children there in school that otherwise wouldn't have access to that, and we hope to expand that program to provide them eye care because they estimate a large percentage of these youngsters can't see well enough to learn, and so that impacts their life as well. So.
No, that's critically important. I mean, I'm one of those guys that had that vision test in school and led to me getting glasses, so I can personally speak to that.
Yes,
it's great you're doing that.
Yeah, and so, if we work together, and that's the foundation's goal, is to work with the state, with local government, with nonprofits to help the kids of our state, and so having a leader like you really makes that much more possible. Now, is there anything else that you want to mention about the state of Michigan or anything else on your mind now that I have you here that you think is important for our listeners to know?
Well, when it comes to this whole issue about caring for our kids and health care, I really appreciate just the creation of your show. That does take a major step forward in terms of highlighting things, as we talked about earlier. And in Michigan, we should be proud. Healthy Kids Dental, Healthy Michigan, these are wonderful programs that we've seen great outcomes from. And again, I want to continue to work on areas such as mental health and physical health integration. And one of the areas we need to work on is reducing opioid abuse,
absolutely,
painkillers, and all those kind of issues, because that's at a crisis stage across our country, and Michigan needs to be a leader in addressing that. So I think you got a lot more important topics that I look forward to your coverage of them, and any way we can help you support getting the word out and how we can do better, let's go for it.
All right, well, thank you. I will definitely keep you posted, and we appreciate it. I might say that I've already started some discussions up in Midland, where there's some, as you know, some great philanthropic organizations, and I've reached out to the College of Medicine at Central Michigan University. I happen to be a graduate of CMU, and our goal really is to impact the state of Michigan and the kids in the state, and so with your help, I think we can continue to do great things.
Sounds good. Look forward to working with you.
Thank you, Governor, very much. That was Governor Rick Snyder from our great state of Michigan. And coming up next, we're going to talk to Dr. Jeffrey Taub, Division Chief of Oncology at the Children's Hospital of Michigan. And that's when Caring for Kids returns right here on the great voice of the Great Lakes, News Talk 760 WJR. Dr. Jeffrey Taub is the Division Chief of Oncology at Children's Hospital of Michigan and a pediatric professor at Wayne State University. Dr. Taub has a long history with Children's Hospital of Michigan. He also is a surviving cancer patient who spent many nights at the hospital himself. He completed his residency at CHM and has been practicing at our hospital for over 20 years. Dr. Taub's research interest lies within acute lymphoplastic and acute myeloid leukemia. Hopefully I did okay with that. two forms of leukemia that often attack children. So, Dr. Taub, welcome to Caring for Kids.
Thank you, Larry.
Appreciate it, and also appreciate all the great work that you do and that you have done for the hospital and the children of our community. And so one of the interesting aspects of your life's journey is that you know a thing or two about pediatric cancer from a personal standpoint and now as a dedicated professional. And can you tell our listeners how that personal battle might have influenced you and how it changed your life, just to sort of tie those things together?
Sure. When I was 15, I was in the 10th grade. I was diagnosed with a type of cancer known as Hodgkin's lymphoma. I'm from Windsor originally, and my pediatrician, who knew of the reputation of Children's Hospital of Michigan, decided to send me across the border to sort of undergo more further evaluations and to consult with the doctors there and to begin some of the treatments there. And I really respect that he sort of reached out and looked at what was the best place in the community to send me, and sort of forgetting about crossing the borders, that was the place that I needed to go.
Right.
And I recovered fully, and that was sort of the impetus for me to decide to go into medicine. And then ultimately I thought, well, you know what? Why wouldn't I not want to be a pediatric oncologist in sort of taking my own personal experience and try to use that to care for children, sort of pass it on?
Yeah, well, that is fascinating. Do you ever? I'm a cancer survivor twice, and once in a while I'll use that to encourage people to, keep a positive attitude. I mean, do you ever use your personal involvement when you were a youngster now when you talk to parents or patients?
Yeah, no. Earlier in my career, I was a little reluctant to tell people about my own personal history, but as I've progressed through my career, I'm much more open about telling people and trying to sort of offer hope and encouragement and sort of say it's one part of their life, but it's not. It's sort of a speed bump or a pothole, but it's not a roadblock that our aim is to sort of treat, but not only to treat, but to cure, and to cure somebody with a excellent quality of life. Like if we're treating a child or a teenager, we want them to fully recover, to then go on to lead a healthy adult life, and to sort of go on and achieve whatever they want to do.
Right, just like you did, and so that's important for people to know. And so I also understand you're partnering with the Children's Hospital of Michigan Foundation. Great place, I think, and Wayne State University to conduct some pretty fascinating cancer research focused on leukemia. Can you tell our listeners a little bit about this new effort?
Sure. Well, leukemia is the most common form of cancer in children, and the two types that you had mentioned, one known as acute lymphoblastic leukemia, or ALL, has really high cure rates. And then the other form, known as acute myeloid leukemia, or AML, has a much more guided prognosis. And something that you always face whenever you're diagnosed with a child with cancer, including leukemia, is the parents obviously want to know, can you cure my child? But then in the next breath, they want to know, why did my child get leukemia? Could we have caught it earlier, and could we have prevented it? And how about our other children? Could they get leukemia? And that's something that has always fascinated me. It's could we find out what causes cancer, including leukemia? And another personal note is my own niece was diagnosed with ALL about 18 years ago, was treated at Children's Hospital. Unfortunately, is now training to be a pediatrician at Children's as well. So I could sort of say, even personally, my own niece developed leukemia right under my nose.
So we're talking to Dr. Jeffrey Taub, Division Chief of Oncology at the Children's Hospital of Michigan. And the Kids Without Cancer, the organization that you mentioned, is a great organization that's been supportive of us for many, many years. And so good shout out to them. Thank you for doing that. And if they're listening, thank you all for your help. Now, in closing, I thought I'd just ask you about anything else that you think is important. We have a lot of parents listening, grandparents listening, of the type of research or activities regarding pediatric oncology going on at Children's Hospital. You want to close out with couple things that you want people to know?
Sure. I think that you sort of see advertisements from national organizations about supporting cancer research. But I think it's really important that if we have stuff going on in our own backyard, in our own community, we really should support our own sort of community and our own local children's hospitals, our own institutions, universities, medical schools, the foundation, that we really have a large number of projects that we really have ideas about exploring for childhood cancer research. So we don't have a shortage of ideas. It's just a shortage of money and funds. And I'm just really appreciative of the Children's Hospital of Michigan Foundation over the years that they have been really instrumental in supporting our research. We have published our research results in sort of really high-profile medical journals that are read by people all around the world. And some of the research that we've developed has actually gone back, what we call translated back from the lab to the clinic, where we've been able to sort of propose new treatments for childhood cancer based on the research that has been supported by the foundation. And I can just envision that with ongoing continued support, this is just going to expand further. And ultimately, we can sort of say that childhood cancer is curable, that every child diagnosed with cancer will be cured.
Wouldn't that be nice? So, well, with people like you and people who support the foundation, like Kids Without Cancer, that dream could actually be real someday. And I want to thank you for joining us. This is our inaugural show of Caring for Kids. And I couldn't think of a finer professional leader to have on the show to talk about your work. So thank you, Dr. Taub.
Thank you. Thank you for the support from the foundation.
It's our pleasure. Thank you. That was Dr. Jeffrey Taub, Division Chief of Oncology at the Children's Hospital of Michigan. Thank you for joining us for our inaugural episode of the Caring for Kids radio show. I'm your host, Larry Burns. I'm President and CEO at Children's Hospital of Michigan Foundation. The Children's Hospital of Michigan Foundation is a proud sponsor of this program, and for more information on Caring for Kids, you can visit us at www.chmfoundation.org/caring for kids. We have a Twitter handle now, so follow us at CFK Radio Show, CFK Radio Show on Twitter. Feel free to email us any questions to caringforkids@chmfoundation.org, or as always, you can email me directly at larry.burns@chmfoundation.org. Join us next time at 7 p.m. on Tuesday, March 28th, for more discussion about the health and health care of children on the Children's Hospital of Michigan Foundation Caring for Kids radio show, here on the great voice of the Great Lakes, News Talk 760 WJR.